At the home front, Malaysia has taken note of the WHO announcement that it would convene an emergency panel meeting this week on the SARS-like virus, which has spread beyond China's borders. Deputy Health Minister Dr. Lee Boon Chye said Malaysia was already on high alert and the ministry would be announcing additional measures to prevent the spread of the coronavirus. He added the meeting by the world body reflected the potential seriousness posed by the mysterious coronavirus infection, which is now spreading to other countries, as well as the appropriate actions that need to be taken. Health Director General Datuk Dr. Noor Hisham Abdullah on Monday announced that response teams at all international entry points and health facilities across the country had been placed on high alert following the outbreak. Thermal scanner desks and health quarantine centres at the Kuala Lumpur International Airport have also been placed on a high surveillance mode. On the parallels to the previous SARS outbreak that affected Malaysia in 2003, Dr. Lee said the coronavirus also spreads like the influenza virus. As such, it was important to prevent patients developing such infection from entering Malaysia. Travellers detected with the symptoms at all entry points will be quarantined and treated immediately. Now, airlines are also taking necessary measures to prevent the coronavirus outbreak in China from spreading beyond ground zero. Malaysia Airlines said it is abiding by aviation health procedures placed by the WHO and International Civil Aviation Organization, ICAO, when interacting with a potentially infectious traveller. In a statement, the airline also said it is implementing certain control measures such as pre-departure screening for travellers who are unwell. The national carrier has also provided medical communicable disease kit in every aircraft as a precautionary step for dealing with sick passengers in flight. New in light of these new developments, let's find out more about this coronavirus. With us on the line is respiratory specialist Dr. Kao Ken Seong from Sunway Medical Centre. Thank you so much for joining us tonight.
Yes, Amanda. However, rather than differences, the new virus, based on the analysis of its genetic code, has shown that the 2019 coronavirus is more closely related to SARS than any other human coronavirus. Both are coronaviruses, which is a broad family of viruses, and only 6, and now the new one would make it 7, are known to infect people. And like SARS, scientists believe an animal source is most likely the primary for the new virus, and human transmission has occurred.
Speaking of human-to-human transmission, which the Chinese authorities confirmed today, what can you tell us about this new development, Doctor?
That's right, Amanda. The main way that human-to-human transmission works for the novel 2019 coronavirus is likely, like other coronaviruses, spread through an infected person's respiratory secretions, such as coughing and sneezing, and also through close contact, such as caring for or living with an infected person. Others include contact with infected live animals or ingestion of contaminated uncooked meat and eggs of affected animals.
Doctor, how accurate is the predicted number of people infected with the virus? Last week, a paper published by scientists with the MRC Centre for Global Infectious Disease Analysis at Imperial College in London said that the number of those affected in Wuhan was likely to be well over 1,000.
Not very accurately, in my opinion. This is just an estimate, and I will tell you why. In our interconnected world, disease can potentially infect billions in weeks or less. Airlines carry infected people from one side of the planet to another faster than any time in human history. Almost any city on Earth is a maximum of 18 hours away, so the number of people infected could be far greater than official figures might suggest.
Now finally, Doctor, how do we go about dealing with a virus that is new? There's not much information about it and we are constantly learning something new about it.
I think the best way to deal with a new virus that can potentially cause a global pandemic is the willingness of countries affected to share information regarding the etiology, clinical manifestation, transmission, and most importantly, the genomic sequencing data of the emerging coronaviruses from cultured virus or from samples received from pneumonia patients in order to understand and study this new virus. Closer to home, my advice is if you are just returning from a high-risk area or are in contact with confirmed cases or suspected cases and are yourself suffering from signs of infection such as fever, cough, and breathing difficulties, then seek immediate medical attention. Otherwise, avoid contact with people who are unwell or showing signs of respiratory illnesses. Practice your cough ethics, such as coughing into your tissue. Wear a mask and wash your hands frequently, and don't eat raw, uncooked meats and eggs.
Thank you so much for your insights, Doctor, and thank you for joining us this evening.